Removal of skin cancer lesions has often left patients scarred or deformed, but now there is a new innovative, painless, and non-invasive therapy to remove skin cancer. Dr. Wendy Roberts, a board-certified dermatologist, reveals the successes of this therapy.
There is a new type of therapy for non-melanoma skin cancer, and let me tell you how it works. Basal cell and squamous cell affect millions of Americans. And the treatments for those, the classic gold standard treatment is surgery, excision. We excise lesions here, nose, ear, and there's unsightly and sometimes devastating consequences where people actually, lose parts of their ear, lose parts of the lip, lose parts of their nose. And this gold standard treatment has been around for decades. So on the scene comes image-guided superficial radiation therapy called image-guided SRT. Game changer, revolutionize. I don't have to remove skin cancers by surgery anymore. It's a type of an X-ray treatment, so it's radiation therapy, and the skin cancer, let's say, is on your cheek, and the radiation comes, and we do treatments on it, and we shrink the lesion. But what's so revolutionary about it is we see the lesion shrinking. So it's image guided. So when I'm treating my patients, I project and visualize the lesion, and I see the big skin cancer. And then over time, with each treatment, I'm watching the skin cancer leave. So you can actually see in real time with ultrasound that the image is gone. Therefore, we don't need Mohs surgery. We don't need to cut out lesions. We don't need to check margins. And what becomes a very painful, deforming procedure is now simply a visit to me, a few pumps of light, and the skin heals magnificently. The skin cancer is completely cured, and we see it in real time.
Dr. Roberts tells us some of the successes with this procedure.
So I had a 62-year-old male patient who had lots of skin cancers all over his face and had a lot of surgeries. He had a large lesion on the nose. It was definitely going to be a tough lesion to treat. So what I did, I used the SRT method and was able to treat the lesion, and his nose returned to normal. No surgery, no scar. I had an interesting case of a 63-year-old man with a very large squamous cell carcinoma on the shin of the leg. This area has very thin skin. It can cause infection and a lot of problems. So I was able to do the SRT procedure to the shin skin cancer, and it healed beautifully. You can't even see it.
Dr. Roberts has an important skin cancer guideline for you called the Roberts Rule.
The Roberts Rule to detect a skin cancer early is this: if you have a burn, a pimple, a scrape, a bump, a bite, a scratch, and it does not heal in 30 days, you do not have any of those. It's possibly a skin cancer. You need to call your board-certified dermatologist, go in and get it checked.
For an appointment, call Dr. Roberts at 760-346-4262